Good afternoon. I'd like to welcome everybody to the public briefing for COVID-19. Today, March 22nd at 4:30 p.m. I'm Brian Beam, Parish Administrator. And this, of course, follows earlier this afternoon, the governor issuing a new executive order that takes additional actions regarding the COVID-19 virus. We're going to have a few folks touch on this. The key thing is, and you'll hear this a lot today from our speakers, local officials. We just met, the executive policy group talked about all of this, and we support the governor's actions and we want to comply with those, and we feel good about where Calcasieu Parish is and the citizens and how we've been responding. And so this is a little bit deeper level, but it's certainly one that is very manageable. I'd like to start, as we usually do, with Dr. Lacey Cavanaugh, Region 5 Director of Public Health Office, for the latest on the cases in Louisiana.
Hi, good afternoon. As of the last time the website was updated, we had 4 cases here in Calcasieu Parish that are confirmed, and also 1 case in Beauregard Parish that is confirmed. We know that these are not all of the cases that we will eventually confirm. Remember, as we've talked about before, all of those tests that have been run out in the private sector still have 24 hours once that case is reported before that information gets submitted to the Department of Health and before the website is updated. And remember that there's also kind of a long turnaround time for some of the private labs right now, where it may take 4 days or 7 days before we get results after the test is run. And so we do expect that there will be more cases within Southwest Louisiana going forward. We also have to keep in mind that it can take 14 days from the time that you were exposed to the virus to the time that you start to show symptoms. The average is closer to 5 days, but for some people, it will take up to that whole 2-week period before they start to show symptoms of the virus. And so I do want people to realize that this website, although it is staying as accurate as possible given the circumstances, it does not represent how many cases we eventually expect to see within Southwest Louisiana. Hence some of the actions that you will hear more about here today. I'd also like to report that the website, instead of being updated twice a day, will now only be updated once a day at noon every day. So check that website at noon. Once again, it's the LDH website. It's, somebody remember the web address? LDH.la.gov. And that's the newest that we have to report. Thank you. And I'll also like to invite Dr. Jordan up. He works with one of our local hospitals to talk just a little bit about the state of the medical community.
Good afternoon, and thank you, Dr. Cavanaugh. I want to remind our community we still are in a window of opportunity that we can certainly affect the outcome for our five parish area. But it's important for our community to understand the why. Again, to echo Dr. Cavanaugh's feelings, we feel like this virus has been in the community for several weeks, and we've probably had a lot of our citizens infected and not even realize it. So we realize that we are changing strategies, going from a containment to a mitigation. I know the governor in his statement talked about mitigation measures, and that's exactly what we're doing. So we're shifting a lot of our strategies, and again, I can't emphasize the importance of people staying at home. I don't really think these are extreme measures. I'd rather be an extremist today than be perceived 2 weeks from now as being not extreme enough. So the important things are for people to stay at home. We can't emphasize that enough. The hospitals, and I've talked to Mr. Kevin Holland with regards to Chris's Austrian health system, our ED volume is in good shape. It's actually down a little bit, which is good. With regards to our critical care capacity, we're also in good shape today. What we're wanting to guard against is not being in good shape 10 to 14 days from now. So as you know, we have restricted visitation severely. Again, we're trying to keep the virus out of the hospital. We're trying to preserve our healthcare delivery system for those patients who need it the most. And again, we're encouraging people, if you've got mild symptoms, certainly call your doctor, stay at home. Our clinic strategies are going to be evolving this week. We're going to be cutting back or encouraging people to stay at home and try to communicate over the phone or via video conferencing platforms that all the hospitals are erecting. So again, this is a time for us to stay calm, realize that the vast majority of patients are going to have a disease kind of like Coach Sean Payton had. Coach Payton had no fever, no cough, felt kind of bad, but he had the virus. We're going to have a lot of that. So again, I just want to encourage everybody, really this is in your hands. And you're the most important partner of this team, and we need you right now. So again, thanks for letting me have a few words.
Thank you, Dr. Jordan. That was very helpful. Our next speaker is going to be Emergency Preparedness Director Dick Grimion.
Thank you, Brian. I think we've been inching towards this day for the last week. For the benefit of those of you that didn't see the governor's press conference today, we're going to read a few things that he said, but I think the most startling thing that he showed was that our trajectory on the cases of COVID-19 is the highest in the world right now, even surpassing Italy on a per capita basis. In other words, for our population, our increase is greater than anywhere in the United States and around the world. So that is a stark assessment of where we're heading. Both doctors discussed the consequences of us not doing anything. Again, for the benefit of those of you who didn't see the governor earlier, I want to read a few things. All state buildings are closed to the public effective immediately. Essential state functions shall continue. All gatherings of 10 people or more are postponed or shall be postponed or canceled. This applies only to gatherings at a single place at the same time where individuals will be in close proximity to each other. And again, it's going to take a day or maybe several days to understand what some of these things really mean. All individuals in the state are under a general stay-at-home order and are directed to stay home unless performing an essential activity, and we'll get to that in just a minute. Obtaining food, medicine, and other similar goods, these are exemptions. Obtaining food, medicine, or other similar goods necessary for the individual or family member of the individual. Obtaining non-elective medical care and treatment, other similar vital functions for an individual or family member. Going to and from an individual's workplace to perform a job function that is necessary to provide goods and services. And we're going to have a link on our webpage that will give you a guide, and I'll touch on that in just a minute. Again, exempt, going to and from the home of a family member, going to and from individual's place of worship, engaging in outdoor activity with more than 10 people where maintaining a distance of 6 feet is not possible. Following non-essential businesses shall be closed to the public. All places of public amusement, whether indoors or outdoors, including but not limited to locations with amusement rides, carnivals, amusement parks, water parks, trampoline parks, aquariums, zoos, museums, arcades, theme parks, any theaters, concert, music hall, adult entertainment venues, racetracks, and similar businesses. All personal care and grooming businesses, including but not limited to barbershops, beauty salons, nail salons, etc. All malls except for stores in a mall that have a direct outdoor entrance and exit that provide essential services and products. Businesses closed to the public pursuant to this provision shall not be prohibited from conducting necessary activities such as payroll, cleaning services, maintenance, and upkeep. Any business not covered by this guidance from the CISA is discussed in Section 3 and not ordered temporarily closed by Section 4 shall reduce operations to continue with a minimum number of contact with members of the public and potential employees, requiring proper social distancing. Further 10-person limitation on gathering shall apply to such businesses and operations. So I think the summary is essentially what the governor had already said, but now the restrictions are squeezed down a little tighter. There's a memorandum from the Department of Homeland Security that we'll provide a link for. It gives an outline of businesses and industries that are exempt from this order. Of course, one of the biggest issues is what about industry? They're specifically exempt from this order. Again, we'll put this link out so that you can go to this web page. It is called the Memorandum on Identification of Essential Critical Infrastructure Workers During the COVID-19 Response, and it's from the Department of Homeland Security. Operationally, we're still at the same level, although as the number of cases rise, that may change. I think that's all I had, Brian. Thank you.
Next, we'll hear from some of our elected representatives, and we'll start with President Guillory from the Calcasieu Parish Police Jury.
Thank you, Brian. The Executive Policy Group met, and we fully support the actions taken by the governor. Please take this serious and stay at home unless absolutely necessary. Do it for the safety of yourself, do it for the safety of your families and friends, and do it for the safety of our community. We are counting on everyone to help beat this virus. Thank you so much. Thank you, Brian.
Okay, next we'll hear from the Mayor of Lake Charles, Mayor Nick Hunter.
Thank you, Brian. Ladies and gentlemen, now's the time for further action. We unequivocally, without question, support the governor's stay-at-home order. To the people of Lake Charles and Southwest Louisiana, stay calm, stay safe, and stay home. Since the beginning of this crisis, Southwest Louisiana elected officials have met on a constant basis in order to act with unity and cohesion. Cities, the parish, the school board, law enforcement, and most importantly, the medical community have all been at the table when we decide on certain courses of action. Like a natural disaster, the situation we find ourselves in does not affect only one city in this parish. It affects all of Calcasieu Parish and Southwest Louisiana. For that reason, it has been even more important that when we speak with one voice. This is why the Executive Policy Group exists, and this is why we have held daily media briefings after each Executive Policy Group meeting. Local government took proactive, early steps to encourage social distancing and a limitation of movement. We unequivocally, without question, publicly supported the governor's executive orders of March 16 and encouraged citizens to do the same. We have taken steps to enforce these orders and will continue to do so based on the governor's order today. From the outset, we have encouraged people to stay calm and stay home. That message has been consistent, and we reaffirm that message today. Stay calm, stay safe, and stay home. To be sure, we have a myriad of other concerns. We realize there is not a single citizen or industry in Southwest Louisiana that has not been adversely affected by coronavirus. It will take a coordinated effort, just like after we did after Hurricane Rita, with public and private interests working together to make sure that we pull through this together. When your elected officials make decisions, they will be based on the most accurate and up-to-date information we have. And in this case, that especially means including input, again, from the medical community. I cannot stress this enough. When we have made a decision to do something or not to do something during this current crisis, those decisions have always been made with the medical community at the table. Our message is consistent and clear. Stay calm, stay safe, and stay home. Listen to the directives from local and state leadership. These can be scary times, but Southwest Louisiana is a strong community, and we believe in the resiliency and the compassion of our brothers and sisters right now. Stay calm, stay safe, and unless it is absolutely an impossibility, stay home. Thank you.
All right, we want to add a speaker today. Obviously, a lot of the things we have to follow are coming from the state government level, Governor Edwards in particular. And so we asked Senator Ronnie Johns from the Southwest Louisiana Legislative Delegation to join us today. As you know, they are out of session right now, but we need all the local leadership to communicate what they're hearing and seeing, and we would appreciate, and we do appreciate, Senator Ronnie Johns joining us today.
Thank you, Brian, and good afternoon. I'm Senator Ronnie Johns, and I'm here today to share some thoughts from not only the legislature, but our collaboration and work with the governor's office. This afternoon at 1:30, the entire Louisiana legislature was invited to participate in a conference call with the governor's staff before the governor went live at 2 o'clock with his announcement of his executive order. And I can assure everyone that the governor's actions today didn't come lightly. They came with a lot of deliberation. They came with a lot of thought and a lot of care. But especially they came with a lot of professional advice from healthcare professionals, from the federal government professionals, from a whole lot of other perspectives out there that made this necessary. The executive order will go into effect to Monday afternoon, tomorrow afternoon at 5 p.m., and it will stay in effect until April the 13th. That April the 13th date is always subject to change, as has been any other executive order that the governor has issued. I think the most important thing that we want to assure our public that this is not martial law. It is a stay-at-home, a shelter-in-place. It's a common-sense approach to us getting out and ahead of this virus. And the governor's staff and the medical experts that were on the phone today shared with us a lot of reasons why they're having to do this. 2 weeks ago today, there were no cases reported in the state of Louisiana of positive identified cases. 1 week ago today, there were 98 cases identified in 10 parishes. Today, as we stand, and I don't have the numbers as late this afternoon, but we have 837 cases in 26 parishes with 20 deaths. As mentioned earlier by Mr. Grimion, this rate of acceleration leads not only the country, but it leads the world in per capita, and that's a scary thing for our state. So it is a responsible thing to do. It's about healthcare capacity. It's about having the necessary healthcare facilities available to have the personal protection equipment available in the hospitals, which is a critical issue right now all over this country, of having the necessary masks, the gowns, the personal protection for the personnel, the real heroes out there, the healthcare professionals who are testing people, who are caring for people, and we have to protect them also. I would just implore upon the public to take this very seriously. We as a society, we as a community, we are responsible to our neighbors. When we act irresponsibly and we get into large groups of people, we are acting irresponsible, and we're putting a whole lot of people at jeopardy. So I would implore upon everyone to heed this executive order very, very seriously. I can assure you that the Louisiana legislature is deeply involved on a daily basis. We have a conference call each day. We're constantly in touch with experts, with the governor's office, and we will do everything in our state's power to get out ahead of this. So thank everyone for their cooperation, and I can assure you we will win this battle. Thank you very much.
Thank you, Senator Johns. We really appreciate you being here, and it's helpful to get the latest information from the state level. We are next going to hear from our Sheriff, Tony Mancuso.
Thank you. As always, I think people just need to take a deep breath. The good news is we live in a great state with great culture, and people just need to relax. We're doing something we're not used to, and that's not hugging and touching each other and staying our distance, but it's for our own good. There is no lawlessness going on. We are still going to stand to what we've said all week long. There's going to be no curfews. There's going to be no interstate closures. There's going to be no road closures. In that respect, commerce and business will go on as normal. There's no need to do that. It serves no purpose for our community to do those things. The roadways are not a hazard where you can catch the coronavirus. It's in closed spaces and close proximity. So relax. Don't listen to Facebook rumors and internet stories. I promise you, and I've said it all along, we are not going to hide anything from you. If we feel like you need to do something, then we're going to portray that to you. What we're asking today, we're not asking you to lock yourself in your home. If you need to go walk your dog, if you need to go outside and play with your children, we're asking you not to get close to people. Go to the store when you need to go to the store. And when you go to the store, don't stand right up next to the person and laugh and joke. Stand your distance and communicate and nod, and just like we do. Look, I can tell you here, we don't get close to each other, and that's very abnormal. We're sitting far from each other. We're practicing what we're preaching. So all we're asking you to do is use some common sense and do what our physicians are asking us to do, and we're portraying that to you. If you have to go to the doctor, then by all means, call your giver. And if you need to go check on your grandmother, if you need to go check on your mother and father who are elderly, you certainly can do that. So you're not being held hostage in your home. We're asking you again to use good common sense, and let's nip this in the bud and use and do what we do anyway, and as a community, and listen to our authorities about what's best for you. And what's best for us right now is to, again, like the governor said, stay home if you can stay home. We have industries that have to work and have to provide things that we need. And, you know, our healthcare workers, nobody's providing more than what we need than them right now. So keep them in your prayers and in your thoughts, but we can help them. We can help them by staying our distance and doing what you're being asked to do, and not get overwhelmed, and they haven't so far. Our grocery store workers, look at them that are having to stock our groceries and do those types of things. God bless them. They're working hard to keep up with the demands. But let's protect them too by going get just what we need and doing those types of activities on a limited basis. So again, you know, you can go outside your home and walk your dog and go outside and play with your children. Just try to limit your social interacting with each other. Thank God for FaceTime right now, because that's a great thing for us to communicate with and talk with. So things are really very normal from a law enforcement standpoint. I have been in touch. Either I or Stitch have been in constant contact with our other chiefs. They're saying the same things. There is no lawlessness going on and crime running rampant. As a matter of fact, probably just the opposite. Because so many people are at home, they're watching each other and taking care of each other's neighbors. Our thefts seem to be down. So things are really, on a law enforcement standpoint, pretty calm and pretty below normal, to be honest with you. And I can promise you, if you're a drug dealer, we're still going to arrest you. If you're a thief, we're still going to arrest you. Those things are not going to change for your law enforcement, all right? We're going to keep law and order in our community. From a social standpoint, everybody just take a deep breath. Let's relax. We're going to get through this. I promise you that we are going to get through this as a community, and we're going to be better for it eventually. But it doesn't mean it's not going to be a little painful for all of us. But we're here for you. You're elected officials. We're not going anywhere. We're going to take care of you. And we're going to do whatever it takes to make sure that we all get through this in a calm and rational way. But it's really up to you to do your part. So I appreciate you. If you're a praying person, say your prayers and relax and take a deep breath. Many of us can't go worship at our church like we want to. I know my church service had it online today. I was able to do my service. Say your prayers and relax and be with your family. It's a great time to be with your family right now and enjoy it. Probably the most quality time is our busy lives. We live such busy lives, sometimes we forget about that. This is a good time to spend some real quality time with your family, and we all need that. So thank you, God bless you, and if you have any questions, again, we're like most agencies, we're closing our foot traffic, but we're here. We're here, we're going to answer 911 calls, we're going to answer our calls, we're going to protect you, and we're not going anywhere for you. We'll be right here for you. Thank you. Brian.
Thank you, Sheriff. A lot of wise words from all of our speakers today, and that is the end of the list of speakers we have. But before we conclude, we certainly want to allow time for any questions, if there are any at this time, for any members of the group. Any questions?
I have
Yes.
a question. Okay, a lot of people are asking about the plant workers and the steps that are being done screening-wise for them.
Okay, the question, I don't know if it's come through. There's a question about plant workers, so local petrochemical industry, I think, is probably what you're referring to. Screening, there may need to be a little bit more. Is there any more specifics as far as workers? Is that the question?
Okay,
The question I have here is, what will major industrial employees do to screen workers as they report to work?
Jim, is that something you have a general comment on, if you don't mind addressing that one? Do you want to just come up for a second? Or do you want to just let me know? I think you could say it better than I could. Thank you.
I appreciate the question. And as far as screening goes, many of the industries were able to purchase and get on hand, if they didn't already have on hand, thermal imaging to where they can take employees' temperatures as well as contractors' temperatures when they are coming into the plant. If they see anybody with the temperature, they're not going to embarrass that person. They'll pull them off to the side and say, let's go over here and talk, and they'll talk to a medical professional, get evaluated, and determine if they can actually come into work or not. Some industries are also doing that for contract workers that are having to board buses from remote parking lots to get to the work site, so they're doing thermal imaging on those employees as well before they get on a bus. Brian?
Thank you, Jim. Very helpful. And I will say, I know this latest order, and Dick Grimmy, I mentioned it earlier, is taking what has already been in place and going just a little bit deeper. And one of the main differences, I think, now, as far as a lot less foot traffic, I think as Sheriff Mancuso said, coming into public buildings. State offices are closing. A lot of the cities and the parish government offices will be closed to foot traffic. Doesn't mean we're closed, but it means a lot less people coming in. And I think a lot of the agencies will have their version of checking employees as they come in who are still working. They've been cut back a lot because of the essentials. But for those that do remain, there are procedures in place. That's very common. And thank you, Jim, for letting us know about the industry side. Any other questions? What we will do tomorrow, there will be, because as a reminder, the governor's executive order takes effect at 5 p.m. tomorrow. That's Monday. We will have a public briefing at 2 p.m. here in the EOC tomorrow afternoon. And unless something changes before then, that will be the next one. Thank you for coming.